Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about the ankle sprain and ankle sprain management. An ankle sprain is a very common injury, especially working with young athletes in the area. We see it quite often. Oftentimes they'll be managed and handled by the patient themselves with rest, possibly the athletic trainer getting involved and working with them as well. And sometimes if this is either a more severe sprain, chronic issue that keeps recurring, then sometimes we're going to get involved as well. An ankle sprain, the most common type of ankle sprain is on the lateral aspect of the ankle. If we look at the anatomy here, that's the outside right here. So typically what happens, we step, roll that ankle, and these ligaments on the outside of the ankle, there's 1, 2, 3 back here that can get stretched. Like I said, it's a common injury. It will heal on its own if given the right amount of time. For some individuals, this should be a one-time deal. You let it recover, you let it heal, and you can kind of get back to what you want to do with no repercussions. If this becomes a recurrent issue, these ligaments can get stretched out over time to where it can become very easy to re-sprain that over and over and over again. That's where we come into play. We try to work on education on what's going on. Hopefully we can handle this conservatively. Strengthening is the big thing. We want to strengthen all of those muscles around that ankle to stabilize that joint. These are kind of our first line of defense, the ligaments. If those get stretched out, now we have to rely on those muscles to turn on, fire, and act quickly to protect that ankle so those ligaments don't continue to get stretched. Hopefully we can do that. If this continues to be an issue, that's where persistent ankle taping can really be helpful for an athlete. Also ankle bracing. Basketball, volleyball players, you'll see this a lot. They'll wear braces kind of proactively to avoid this issue from coming up in the first place. But like I said, hopefully we can train your body to take care of this on their own. There are occasions too where in physical therapy we're going to run into some kind of additional issues that we see. If somebody has a bad ankle sprain or maybe a chronic recurrent ankle sprain, they can get what we kind of call an ankle dysfunction, which basically means the joints of the foot, that could be from the midfoot to the ankle joint itself, can have a dysfunction where the joint is not moving the way it's anatomically supposed to. That's a term we call arthrokinematics in physical therapy. So we can do some different things in the clinic, some manual therapy techniques to try to kind of establish the normal movement, hopefully take some of that pain away and get you back to moving normally and back to the sport or activity that you want to do. If you have questions on ankle sprains, have had ankle sprains or issues yourself that maybe have been chronic and want to see if there's something that can be done at this time with physical therapy, feel free to contact us at our Dyersville or Manchester location. You can check us out on our website at www.ptsio.com and check us out on our Facebook page. Thank you very much.